Walter Cronkite once said, "America's healthcare system is neither healthy, caring, nor a system." I am upset with Congress. And that's because today the House voted to pass the American Health Care Act, a bill intended to repeal the Affordable Health Care Act and replace it with a new healthcare plan. Now, the Affordable Health Care Act isn't perfect. No healthcare bill is probably ever going to be. But the American Health Care Act is not a good replacement. At least not according to millions of Americans with pre-existing conditions like me. I have two major pre-existing conditions. The first is called Ehlers-Danlos syndrome. It's a genetic condition where your body doesn't produce enough collagen, and so your joints tend to dislocate and your ligaments tend to tear easily. It's a condition I was born with and a condition I cannot change because there's no cure for it. As a result of this, I dislocated and destroyed several important ligaments in my left knee just by standing still. I had to have 3 major expensive knee surgeries. I was in physical therapy for over 6 months, and as a result of the original injury, I developed another pre-existing condition. It's called complex regional pain syndrome, and if you watch some of my other videos, you'll learn a bit more about it. Essentially, my body still thinks that the original injury just happened, and it magnifies the pain signals over time. So anyone with complex regional pain syndrome, also known as CRPF, is left with a constant burning sensation on the affected area. So for example, my left knee feels as though it has literally been set on fire. No hyperbole there, literally been set on fire. And that pain never ends. There's no cure for it. All you can do is learn to manage the pain. It's unbearable some days, and getting the management I need for it is also very expensive. Living with Ehlers-Danlos and living with CRPF is not easy, and it's not something that I ever asked for. The American Health Care Act allows states to waive regulations protecting patients with pre-existing conditions. This means that if a state chooses to do so, and many might because it makes a better profit if you do, those patients are going to have extremely expensive healthcare plans if they're given coverage at all. It's going to be much harder for them to get health insurance, and it's going to be much more difficult for them to afford the treatments that they need. A pre-existing condition could be just about anything. Anything that you had before your current healthcare plan went into effect. Asthma, diabetes, heart conditions, lung disease, chronic pain, fibromyalgia, anxiety, depression, cystic fibrosis, any medical condition that you had before your current healthcare plan went into effect. Oh, and by the way, this bill also has decided that pregnancy is a pre-existing condition. So is sexual assault, something which nobody asks for and nobody deserves. So apparently, being a woman is a pre-existing condition, which is great. If I sound bitter, it's because I am. I'm frustrated and I'm angry that so many politicians were willing to put aside basic human rights in favor of voting along party lines. So many people have been flooding social media and the inboxes and voicemails of Congress people with pleas not to pass this bill, and Congress didn't listen. I'm only 20 years old. I'm a college student still. There is no feasible way for me to afford my own health care. Most college students I know can't even afford their own tuition because I don't know any college kid who makes upwards of $40,000 a year. Once I age out of my parents' plan, I'm on my own. And if my state chooses to opt out of coverage for pre-existing conditions, I might not be able to get the care that I need. The medical world currently has no cures for what I have. But without the treatments and the medicine and the physical therapy that I get, my pain would be unbearable. CRPF is rated on the McGill Pain Scale as the most painful condition a human can have, higher than amputation and childbirth. I would not be able to move or walk or live my life without the treatments that I get. I get shots in my spine every 3 months just to manage the pain a little bit. My joints and my ligaments could fail on me and I could end up needing more surgeries for my shoulder or my elbows or my hips or who knows what else. And without healthcare, I might not be able to pay for those things. Congressman Mo Brooks from Arizona, I believe, said that it was fair for healthcare companies to be able to discriminate against those who have pre-existing conditions because those conditions are the result of unhealthy lifestyle choices. Well, Congressman Brooks, I was born with Ehlers-Danlos, which is a pre-existing condition. I had no control over the matter. And before the CRPS, I was incredibly healthy. I ate fruits and vegetables. I rarely drank soda. I hardly ate sweets or junk food. I ran almost every day. I was a competitive swimmer. I took care of my health. I never did drugs. I don't drink. I don't smoke. I didn't make any choices that led to Ehlers-Danlos or CRPS. Those circumstances were out of my control, and for the vast majority of people with pre-existing conditions, it was out of their control too. And even if it was the result of a decision they made, they're still a person who is worthy of living and having a quality of life that is up to the same standard as everybody else. Their decisions don't make them less of a person, and healthcare is a universal human right. I saw a post on Facebook the other day, and it said something like, why is it that drug addicts can get Narcan for free, but we don't give chemotherapy to cancer patients who need it? Well, I have great news for you. If you believe that cancer patients should be given chemotherapy that they need to stay alive for free, there's a term for that. It's called universal health care, and it's something that Democrats have been pushing for a while. The belief that everyone deserves access to the care they need to save their life and or to improve their quality of life. Whether that's Narcan or chemotherapy, everyone deserves to have health care. The biggest sign that something is wrong is the fact that Congress exempted themselves from this healthcare plan. And you know, they say you should never trust a cook who doesn't eat his own food. Well, that applies here as well. I'm scared for the future because I'm afraid that there may come a day where I cannot afford to get the treatments I need. And I'm not just scared for me. I'm scared for my friend who also has CRPS. I'm scared for my little sister who also has Ehlers-Danlos syndrome. I'm scared for my friend who was born with a heart condition. I'm afraid for every parent or grandparent with Alzheimer's and the people who take care of them. I'm afraid for the children whose parents have cancer and are being denied chemotherapy by their insurance because they don't deem it necessary. And I'm afraid for the parents who have cancer who are trying to figure out what they're going to say to their kids if they don't get that treatment. I'm worried for everybody who has a pre-existing condition, and I'm pretty sure that everyone knows somebody who does. If you love these people, please call your representatives. Ask them to vote no when the bill goes to the Senate. It's super easy to do. The link is below. You can go to senate.gov and type in your state and find your representatives. It's so easy to go to their website from there, call the phone number listed and leave a message. Call your senators. Ask them to vote no. And if your representatives voted no in the House, call them and say thank you. If they voted yes on the bill, call them and tell them how upset you are for their support of this bill and why it matters so much to you. The fight's not over. Today has been a major loss, but the fight isn't over. Please, please, call your reps. And if you are a representative and by some miracle you are watching this video, please vote no. Please do not put party lines and profit before people who need you to support them, before people who need your vote to ensure that they get the care they deserve and the care they need. I am asking this as someone who has spent far too much time in hospitals, as someone who has not had a single day without unbearable pain in the last year and a half. As someone who is 20 years old and has had to use a wheelchair and a cane at points to get around. Party lines and loyalties don't matter. The bottom line is that the American Health Care Act is not good for America. And it's not good for patients. It's not good for people or for families. Please call your reps. Fight back. Post on social media. Talk to people you know. Spread the word. For all of the people you love, for all of the people you know, and for yourself. Please ask your representatives to vote no to the American Health Care Act. Until next time.